Well, it's hard to believe, but it has been 8 months since the Norton West Louisville Hospital opened, and the company hasn't stopped its public feedback sessions. Norton says visitors have been non-stop.
Louisville-based healthcare company designed the new West Louisville Hospital to be a preventative care hospital, a one-stop healthcare center with medical specialties offered that had long left West Louisville. The hospital only has 20 inpatient care beds, but it also includes a Dare to Care food bank. And joining us live to talk about their upcoming public listening session on Tuesday, July 15th is the Chief Administrative Officer of Norton West Louisville Hospital. We're glad to welcome back Corinza Townsend.
Thank you for having me.
Corinza, tell us, 8 months, how many patients are you seeing a month now?
Oh my goodness. Just in the emergency department alone, we're seeing well over 2,000 patients in a month. Yeah, absolutely. So I think we're around a little over 10,000 patients in the emergency department since we've opened. We've done a couple of hundred surgeries. We're seeing thousands of prescriptions going out the doors. It's been a really good 7-8 months.
Yeah. And we know lots of folks in the community are using the hospital, but there are also folks coming from outside the community.
Yeah, you're seeing them come from southern Indiana, from the east end, south end. It's the place to be.
They want to see it, right?
So the big question, and of course this came up when when TARC was selling the NIA Center. The Goodwill was going to buy it, but Norton West Louisville Hospital sits right there. Are you all ready to expand? I know that was originally being talked about as a possibility before that whole deal went south.
Right now, there's no announcement. Right now.
Does that mean an announcement's coming?
Listen, look.
Buzzwords, Corinza.
I know it. We will make sure that we are doing what's best for patient care. And I think right now where we are is this event on the 15th is continuing to get that feedback. We're not going to make a move without having community feedback. And so we're continuing those conversations. And when the time's right, maybe we'll see.
Okay.
He's trying to pin you down.
Oh, yeah.
You're telling journalists these are loaded sentences.
I know it.
All right, so talk about these listening sessions a little bit. Explain to us what's going on and when you'll have that feedback together.
Yeah, so you hear me talk about this is a community hospital and that the community helped us build it. That continues on even after the hospital's built. So specifically on the 15th and continuing on until Lord knows when, we will continue to have conversations and let people know what we're seeing come through our doors and continue to ask people what they need from us. And so we're following those trends and having conversations and saying, what's best practice for you? How do you feel? What do we need to do next? And then also continuing to keep up with the community and make sure they know what we're doing as well.
You wanted the community to think of this hospital differently. In fact, Russ Cox comes on occasionally and he says, we don't care if it makes money and we're still sticking with that plan. The preventative care thing I thought was the most fascinating. Is that part working? Are you seeing people coming into the hospital who had not seen doctors for many, many years?
Yeah, absolutely. So we talk about, I call it a conversion from emergency department to primary care. The goal is when you show up in acute care or you show up in a crisis, we want to make sure that you are following up and that you get on track to see a primary care on a scheduled basis. We're seeing people come through that emergency department or just to come to imaging, they're coming through the pantry and they are getting signed up for primary care on the spot. That's the goal, is to make sure that we are getting in front of illness so that we can, your high blood pressure, your diabetes, even if it's just a yearly physical, we want you established with a healthcare home and we want it with us.
Now, you're doing these listening sessions to find out what people want, but what you've got to be hearing around some of the things. What's like one thing that stands out that you've heard from people, the feedback, just in person?
It's that we are listening, right? If you come in and if you tell us something's going on or just the trust of being able to walk into the building and be heard and somebody's guiding you through that path. And so whereas we have a population here in West Louisville where people sometimes they're afraid to and they don't feel like the physicians listen to them or that their places within our healthcare society, they're coming through and feeling a little bit different about that now. So you could come in for one thing and we will make sure that you have the resources for all the others. I think that's the biggest ear that I hear right now.
Well, always great to see you, and we'll bring you back when there is an announcement.
I know it, or at the 1 year mark, because we're going to continue to have those conversations.
And I love the fact the cafeteria is a local restaurant for West Louisville too. They have you look at it that differently as well. Put it on your calendar. Norton is holding a hospital update and public listening session later this month. They're also going to be talking about hiring opportunities. The event is Tuesday, July 15th, 5:30 to 7:30 at the Fraser History Museum on West Main Street. It is free. Corinza and CEO Russ Cox will be there to answer your questions. Registration is recommended at frasermuseum.org.